First, kudos to the BC government for doing this. It's an important step, and as you said, a big win today. And I do think BC has really always led on the issue, on drug use and toxic drug deaths. And here they are again leading on it, which is great news. That said, this is only an approval by the court to move ahead with a new case. So there's no victory here yet. And if there is a victory, what will come is money from presumably the companies to the provinces, to whoever who joins the class action suit. So what's done with that money is equally as important as if they secure it.
And what have we heard from the province on that?
Well, I don't know. I think I wouldn't expect much, actually, because now they have to put their case together and then follow. I think they still have to be approved to file class action.
Certify. It needs to be certified, and then they would go through a civil suit at BC Supreme Court. So yeah, I guess what I'm wondering is, what is the actual likelihood that BC will see money from this case, and in turn that will trickle down to people who have been affected by this crisis?
Yeah, so I think there is, like I said, we've had so many steps backward on this issue still. I mean, we have 6 people dying a day here in the province, and that's starting to spread across the country. We've lost almost 16,000 people since the state of emergency was declared in 2016. And sadly, myself, I've lost 2 family members to this, one last week, which is hard to take. And so I really empathize with the families of the 16,000 people that have died.
I'm sorry to hear that.
Yeah, thanks. Susan and Kyle were really special to our family, and I just talking to those who have lost people as well. It's a very difficult thing, but what's more difficult is government inaction. And in fact, we've seen many steps backward due to, I think, like false information put forward to people who are trying to capitalize on this tragedy. So we're hearing it right from the top. Pierre Poilievre calling supervised consumption sites drug dens, saying they're going to roll back these facilities that save lives.
We've heard it from John Rustad as well.
That's right. And in fact, we had Premier David Eby take quite a large step back on decriminalizing drugs. So really what's happening is fear is conquering science. These suggestions for decriminalization, safer supply, consumption sites were put forward by our police leaders, our health community leaders, but now politicians are ignoring this very strong indication of what we have to do because of the misinformation that's out there.
Just to push back on that, despite those steps that have been taken, we are still looking at a death toll of 6 people dying per day. Yeah. So I guess people are wondering, they have the concerns around public safety that we've heard that they've raised when it comes to decriminalization and drug use in public, but also that it continues.
Yeah.
So when you talk about rolling back, is it not just also looking at other options?
Yeah, I mean, I think the concerns about public safety are valid. I do think there was a consensus on this by governments of all stripes, really, up until the pandemic. And in fact, in 2019, we were making great steps forward here in British Columbia with seeing a real drop in the death toll. But when the pandemic hit, it really blew the doors off the whole thing. And now we have to regroup and come together and try to build a consensus around what steps are next. And we're only going to do that by dealing with the bottom line figure, which is how many people are dying per day. And let's have a commitment to say, let's half that. So what will governments do, knowing the information that they know today, to use resources like they may secure from this court case, the resources that we have, to drop it from 6 to 3 people a day, which is still horrendous. I have one friend who's lost 57 friends to this. I mean, that's war level loss.